On to our fourth panel discussion on gambling disorder as a public health issue. The panel will be moderated by Christina Golna, Head Policy Change and Management Consulting, Innowth Limited, Cyprus. A gambling disorder is considered a public health issue. What should be the framework for introducing the concept of public health across the gambling disorder continuum? Is there a need to integrate gambling disorder in the general health services system? What is the cost effectiveness of such an approach? This panel of experts will discuss how a public health approach towards gambling disorder might be implemented.
Thank you, Chair.
Ms. Golna.
Can you hear me? Yes. Thank you, Chair.
Yes.
Thank you very much to the organizers as well for this session. It is a pleasure and a sheer honor to be moderating our two panelists. When looking through the literature, really, to refer to their work, you are humbled by the breadth of scope and the depth of the analysis into gambling disorder. So without further ado, I will be introducing and starting with the ladies, Professor Dr. Rachel Volberg. She is a research professor at the School of Public Health and Health Sciences at the University of Massachusetts in Amherst in the US. She is one of the world's leading experts on the social and economic aspects of gambling and problem gambling. And she is the first researcher to receive funding from the US National Institutes of Health to study the prevalence of problem gambling in the general population. And the next is Professor Dr. Mark Griffiths, a chartered psychologist and distinguished professor of behavioral addiction at the Nottingham Trent University. He is also director of the International Gaming Research Unit there, and he is internationally known for his work into gambling and gaming addictions. And he has won numerous national and international prizes for his research, published an immense body of work, and we are honored to have both of them here. As the chair very kindly said in her introductory note, we listen very often to this public health approach to managing gambling disorder. What I would like to ask both of our panelists is, in your opinion, to make this really practical, what is your advice to a health system or to a government or to a regulator looking to introduce this public health approach into their gaming regulation? What are the defining elements? What are the building blocks? What is your figurative checklist of things they should be looking to introduce to ensure that this public health approach is gradually embedded in the gaming disorder management in a country? So, Professor Volberg, if you want to start.
Yeah, can you hear me?
Yes, clearly.
Yeah, so I think the place to start probably is to understand that a public health approach is focused not on individual people who have a gambling problem, but is a population-focused effort. And so you have to look at the full continuum of gambling harms as we now talk about them, and understand that it's not just individual problem gamblers or disordered gamblers who are experiencing the effects, but it's also their family members, their employers, and others in the community. And so what that suggests is a very broad strategic framework for developing prevention efforts, treatment efforts, and recovery efforts all at the same time. So in Massachusetts, we have a very strong independent regulator of our casinos that were introduced in the early 2010s. And that regulator adopted a strategy for responsible or safer gambling that lays out a number of initiatives. The other thing to understand about what we're doing in Massachusetts, which is very much a public health approach, is that when the legislation to legalize casinos happened here in Massachusetts, the policymakers themselves very wisely ensured that there would be a funding mechanism for all of the prevention and treatment services that would be needed. And that's a very unusual thing. Not very many jurisdictions do that. And so that has enabled us in Massachusetts to begin, even before the casinos were built, to start to measure what was going on with gambling and problem gambling in Massachusetts. We were able to understand the environment in which the casinos were being introduced. We very much took a broad population approach, but we also were able, because of our legislation, to build policy and regulations that were both funded and we think effective in ensuring that people could have access to help if they wanted it, or self-help materials if they wanted those, because we know that only a small percentage of people who actually experience gambling harms ever seek help. So those are the pieces that I think of and that I'm working to implement here in Massachusetts. But I'll give Dr. Griffiths an opportunity to talk.
Yeah, absolutely. So to put this into context, we are talking about a population-focused or a population-based effort that is essentially following the full continuum of gambling behavior. And then you have the funding mechanisms in place so that you can start research early on to understand the environment you will be developing this public health approach into, and how best to protect not only the player, but essentially society as a whole with all its structures and its mechanisms. So Professor Griffiths, would you agree? Would you add to that kindly? Can you hear us?
Maybe our speaker is still on mute. Could you unmute your microphone, please? Because we can't hear you. Professor Griffiths, can you hear us? No, I think Professor Griffiths is unable to hear us, or the microphone is still on mute. Could you unmute your microphone? Are you there? Can you hear us? Okay. Professor Griffiths has connectivity issues, so could we just continue?
Yes, please.
Talk,
yes.
Thank you. Thank you very much.
Yes, sure. So Professor Volberg, coming back to you again. So within this public health approach, would you say that, and I've read your very recent work on the conceptual framework of harmful gambling, how it's a fantastic piece of work, but would you kindly elaborate a bit on that, as well as tell us how this could inform this public health approach on gambling disorders?
So that's a direction that I did not expect to go. But yes, the conceptual framework of gambling harms is an international overview of the evidence base related to the provision of gambling services and and how to minimize and mitigate gambling harm. So the conceptual framework itself consists of 4 broad areas that are not gambling related, and then 4 broad areas that are specific to gambling. The original effort, because the most recent framework is actually the 3rd iteration, but the original intent of the framework was to try to identify areas where research was needed. Because although there is a great deal of gambling research that's been done, there are some rather glaring holes in what we know. And in particular, there are sort of gaps in understanding, what the causal relationships are. So back in 2013, I believe, the Ontario Problem Gambling Research Centre brought together a group of international researchers to basically review all of the literature in these 8 separate areas and try to identify areas where work was needed. The second and now the third iteration have basically been every 3 years updating that conceptual framework to try to understand where evidence is being developed and where there is still a need for additional evidence. The framework is available on the website of the Ontario Problem Gambling Research Centre, morphed into the Gambling Research Exchange of Ontario, or GRIO, and the conceptual framework is posted as an interactive website, I guess, on GRIO's larger website, and it provides research summaries for people who don't want to get into the research. It provides access to the original research for people who want to go to the original sources. So it's a very sort of compact way to access the evidence that we have for the effectiveness of different interventions at all levels, the prevention level, the treatment level, and then, policy and regulation.
So the reason I'm asking really is because the framework assists us passively as researchers or as people interested in this field of work to understand the complex interactions between a number of parameters that affect gambling behavior and then eventually gambling disorder for some. What I wanted to ask is that I think it helps us understand, it sheds light on the importance of general health services in identifying those behaviors or screening for those behaviors first, identifying them, diagnosing them, care. And for a number of healthcare systems, this is largely overlooked as an area of interest. So gambling dependence, addiction, disorder, whatever you want to call it, is being bundled into something that is either substance use disorder or is nowhere to be identified, seen, managed. So how can we ensure by helping the general health system or regulators or governments see this complex modality of gambling disorder? How can we help them understand the benefit of opening up care in general health services, or what is the optimal pathway really to ensuring that a person that develops a gambling disorder can be effectively managed, rehabilitated, and to return back to gaming if and when as a source of pleasure rather than, as a source of a problem?
Yeah, well, trying to integrate gambling services into a broader health framework has been an ongoing struggle as long as I've been in the gambling studies field, which is quite a while. And as I've thought about it, I've concluded that in the same way that there is quite a lot of stigma attached to admitting that a person has a gambling problem, there seems to be an equal amount of stigma amongst health professionals concerned or around the idea of asking their patients or their clients about financial issues. So I think that there is a lot of discomfort on both sides and stigma, and that is probably the first big barrier that needs to be overcome, is to try to educate health professionals and health related policymakers around the importance of building gambling references into treatment for, for primary care as much as well as, substance use and mental health issues.
So I understand that Professor Griffiths is with us now. Can you hear us?
Yeah, I'm really sorry. I don't know what happened there, but it cut out. I hope you can hear me.
Absolutely, yes. Thank you. Thank you so much. Welcome to the session. There you are. We can also see you now. It is an honor and a pleasure to have you
from me there.
with us. So what we've discussed with Professor Volberg is really the elements, the essential elements that would assist a country or a system, essentially also a healthcare system, introduce this public health approach to the gaming disorder or gambling disorder. And that would be a population-based approach to gambling, a continuum approach that covers the full of the gambling spectrum, and then finally the funding mechanisms that are in place to support research to understand the environment. Would you kindly add to that? I've seen your very recent open letter to regulators and governments across the world to do more in this area. Would you like to elaborate on that?
Yeah, I think there's a lot of issues here, and obviously I agree with Rachel totally about a population-based approach. I've spent 34 years in the area, and I think until very recently, most, whether it was regulation, whether it was research, whether it was treatment, everything was focused on the individual rather than looking at the population as a whole. So I totally agree with Rachel's approach there. But I think first, in any, when we talk about a public health approach, particularly on a population level, you've actually got to convince governments and health policymakers in the first place that gambling is actually a public health issue. Here in the UK, our gambling legislation is overseen by the Department of Culture, Media and Sport rather than the Department of Health and Social Care. And for me, that just shows that the government themselves here in the UK are not actually treating gambling as a public health issue because it's not even located in the right department. Once you can actually convince government that gambling is a public health issue, and again, I know Rachel and myself, we're both passionate believers of this, and we've both written editorials for the British Medical Journal arguing that gambling is a public health issue. But, if you're going to do that, then obviously you've got to actually show that you've got to actually show that that it is a problem. You've got to find out, how big the problem is. Rachel's obviously done prevalence survey after prevalence survey, which obviously feeds into knowing how big the problem is in the first place, and developing that data set so that you can actually take this forward is a really important thing to do. We know that, again, when people think about problem gambling, we have to realize is that for every problem gambler, it affects another 5 to 10 people around them. And so, when we come to think about what we're going to do in terms of turning gambling into a public health issue, we have to realize is that we have to get all the stakeholders on board. So it's not just about the regulators and the policymakers, but the industry have to be involved as well, treatment providers, researchers. And obviously, we as stakeholders, we've been coming together for years to discuss the gambling issue. And again, I think in terms of the strategies that have gone on in the past 3 decades, a lot of it has been about just targeting those high risk individuals, those that are problem gamblers, again, without seeing the kind of wider issues. And we need legislative or regulatory measures that are going to tackle lots of important issues like gambling availability, like gambling affordability, like gambling licensing, like gambling advertising and marketing and the price of products, etc. And we need that kind of integrated system, including the treatment system, that, if you think about, gambling does not happen in a vacuum. And we know that there are comorbidities between gambling addictions and other addictions, substance abuse disorders. And obviously there's a high comorbidity between gambling addiction and problem gambling and things like depression, anxiety, stress-related disorders. And when it comes to treatment, you know, we don't want to be reinventing the wheel and just necessarily just having dedicated services for gambling. You know, within the UK National Health System, we have a very good system for treating drug and alcohol addictions. You know, the treatment procedures and processes for treating drug and alcohol people with those problems, they are very similar to gambling. And, you know, gambling should actually just be part of a general addiction service. And I think if gambling was on that public health agenda, is that gambling addiction and problem gambling could then be treated by the pathways we already have in most, you know, I would think in most services throughout the world. You know, we know that drug and alcohol problems form, you know, a small but significant problem in society. The same is for gambling. You know, the treatments are pretty much similar. Yes, everybody, you know, there are idiosyncrasies and we have to fit the treatments to the individual, but whether it's cognitive behavioral therapy or pharmacotherapy, group therapy, you know, individual counselors, these are all things that we find in integrated national health systems throughout the world, and gambling should be part of that.
Would you say, and then the same question goes out to Professor Volberg as well, would you say that there is an element of cost efficiency in doing this? We've seen very detailed work done in 1999 that said that, you know, in the US, that for each dollar you spend in treating people, in identifying and treating people with a gambling disorder, the system basically earns or does not spend $20. So is this 20-to-1 ratio something that would fit in your experience and your calculations?
I don't know about the actual ratio, but it certainly would be cost effective to treat people with gambling problems within a system that's already treating, you know, mental health issues and other types of addiction issue. You know, in the UK, we only have one dedicated National Health Service treatment centre, which obviously is doing sterling work. But obviously we've got a population of 67, 68 million people, of which around 0.5% of that population have a gambling problem. Now, we know that not everybody who has a gambling problem accesses problem gambling services. And, you know, one of the problems is that, you know, the gambling services that we do have are not particularly well known in comparison to, you know, drug and alcohol services. People don't necessarily know where they can go for that type of help in the first place. You know, and we have a very good NHS system in the UK, and it's free at the point of demand. You know, myself and Dr. Jane Rigby, we did a survey where we used the Freedom of Information Act. We contacted every single NHS trust in the UK, and what we found was that only 9% of the NHS service has ever treated a gambling within, you know, a problem gambler within their more general addiction services. So there we've got a case that over 90% of the National Health System in the UK within their addiction services had never even treated gambling there. But it would be a very cost efficient way to do it, because as I say, that, you know, those people who treat drug and alcohol addictions, the way that those people are treated, it would be exactly the same. Well, within reason, it's exactly the same way to treat problem gamblers. So in that sense, it would be a very, very cost efficient way to do it.
Professor Volberg?
Yes, I agree with Professor Griffiths that there are definitely efficiencies that can be achieved. I'm not going to go back to the numbers from 1999 because those are probably out of date and only relevant in the U.S. anyway. But really the issue from my perspective is that a gambling problem rarely travels alone. People with gambling problems tend to have other kinds of issues, either with addictions or with depression or anxiety. And so the efficiency is in achieving a successful treatment outcome means that you have to address all of the problems that any individual client or patient presents you with. So I do think that there is a lot of work to be done to educate and to build gambling treatment into larger health services, not just in the UK, but worldwide. I don't think it's a very common thing at all here in the United States, and certainly from what Professor Griffiths has been saying, it's not very common in the UK either.
And I think the challenge across healthcare systems is that these players, the players that develop a gambling disorder, are largely unseen. And to the extent that they're left out of the general healthcare services, despite the fact that they have comorbidities that could lead them to care and treatment earlier, this just exacerbates the problem and makes it extremely difficult for a healthcare system, but a society as well, to overcome the stigma that is attached to identifying and managing these patients, really, these players. So would you not say that the general healthcare services would be well equipped, at least to, monitor for gambling disorder, especially among comorbid patients, so with patients that present with some sort of mental health disorder or some sort of mental health anxiety, depression? Would it not be efficient for the general health services to also screen for gambling disorder?
I mean, can I just say, back in 2007, I was asked by the British Medical Association here in the UK to look at how gambling could actually be integrated within a more general health system. And one of the primary recommendations I talked about there is a need for just general healthcare professionals, including general practitioners, to actually screen their patients for gambling disorder. They routinely do it for their tobacco use, their drug use, their alcohol drinking, and gambling is just one of those things that's just not on the GP's radars to start with. So for me, screening is absolutely, we should just be doing this routinely. And again, if you look at in terms of the training of medics in most countries, is that gambling, again, is not something that is actually on the kind of general curricula that people do. They're told about alcohol and drug problems, but gambling is just not something there to start. I mean, when it comes to screening, and obviously Professor Volberg will be well aware of this, there are over 25 different screening instruments out there for problem gambling. We're awash with ways that we can actually screen for problem gamblers in the first place, but these instruments are so not used within general healthcare settings. As I say, it's only those that are treating gamblers in the first place that are actually using those things.
So if we wrap it up, what are your 3 bullet points, your 3 recommendations to start doing what exactly you suggested in 2007 in the British Medical Association handbook? So what would be your 3 bullet points to a country to start implementing your recommendations?
I'll go first.
Oh, yeah, sure.
So I think building screening into regular primary care health settings is essential. I think ensuring funding for research and services is fundamental. And I think having the regulators and the industry get behind that effort is probably the 3rd building block that you need. Because what we run into time and time again is if the funding and the public health approach are not built into the legislative intent from the very beginning, then the regulators really have very little that they can do to sort of, get leverage into the health system. So those would be my building blocks.
Excellent. Thank you. Professor Griffiths, just a word from you as well, your 3 bullet points.
Well, there are so many different bullet points that you come up with, and it's hard for me to say which is most important. I want to echo what Rachel just said there, is that funding is critical here. And for me, there should be a statutory levy. I mean, at the moment in the UK, the gambling industry, make voluntary donations towards treatment, research and education. In terms of the vast amount of money that they make, there should be a statutory levy, and that would actually raise millions and millions of pounds, that could actually fund not just, within the National Health Service, but it could also fund dedicated centres as well. There's got to be a realisation from governments that gambling is a public health issue, and therefore, you know, gambling has to be part of a Department of Health and not in some other types of department. And you know, when it comes to you know, thinking about gambling as a health issue, gambling, you know, problem gambling has to be embedded within the general teaching curricula alongside alcohol and drugs.
So thank you very much to both. It's been a pleasure to moderate this session, and back to the chair. Thank you, organizers. Have a wonderful rest of conference. Thank you.